Hello guys, it's a Wednesday and that means we delve into matters medical. We're joined as usual by our resident GP, Dr. Vicky Skitter. Hello Doc.
Hello Jeremy.
Nice to see you again. Now, why do you want to specifically talk about hair loss in women? Because that's what the subject you've sent through for today. But why specifically hair loss in women?
Because I thought, you've got lots of hair, you're lucky.
Yeah, I cut it very short.
But I thought it's quite socially acceptable for males to lose their hair.
Yeah.
So I'm generalizing now. Okay?
Yeah, no, but yeah, I can see where you're
now
coming.
you get a female with a bald patch or two, and that's just really not acceptable. And it's a very, very common thing that I see in my practice. I mean, if chicks lose their hair, it's a disaster. It is. It is a disaster. So I think about the hair growth like I think about a garden. How well the garden grows is an indication of what goes on underground.
Okay.
So someone counted hair one day and decided that 125 hairs or more per day is too much.
Ach, no.
I swear. So that's apparently when you lose too many hairs is when you lose more than 125. Yeah. So I don't know who counts hair, but yeah.
But it is a fairly fast growing thing, isn't it? Hair.
It is.
It
yes.
grows back very quickly, doesn't it?
Yeah. But often when you lose it forever.
Yeah.
Not always, often.
No, I mean there are all sorts of reasons for hair loss. One of them that always springs right to the forefront, always is chemotherapy, obviously. Why does chemotherapy cause hair loss?
Chemotherapy attacks the most rapidly dividing cells in the body. Okay. So the tumor will be affected, but also unfortunately because the hair follicles have got the it's got very fast growing cells. So unfortunately it attacks them as well. So it depends on which drug you use. It depends on what dosage you use and also the frequency of treatment. Not all chemo causes hair loss, but it's very common.
Okay, but then what other things can lead to hair loss?
The most common in females, older females, is family history. So if your mom went bald,
then there's
probably a 50% chance of you losing hair between the ages, from 50 on.
Yeah.
Then pregnancy is a common one, or like hormone changes. So in pregnancy, but that's normal and it's self-limiting, so you don't really treat that. Mm-hmm. And polycystic ovaries and thyroid hormones, that's the hormonal causes. And then certain diseases can cause it, like iron deficiency or anemia, diabetes, liver disease, kidney disease, autoimmune disease, inflammatory bowel disease, and skin diseases like ringworm, seborrheic dermatitis, and psoriasis. And then there are medications that can cause hair loss. So it's beta blockers, antidepressants sometimes the pill, antipsychotics, and also vitamin deficiencies like vitamin A, B12, vitamin C, D, selenium, zinc, and other stuff like stress. Stress is a very common one. So whether it's physical or emotional stress. So physical stress like major illnesses, or big surgery. And that often happens like 3 months down the line. So if you went through a very stressful period or had big surgery or a bad illness or whatever, you think back a bit. Think back 3 months. There is usually a delay.
But as you say, there are quite a few things that could lead to hair loss. I would imagine in some cases they are treatable, in some cases they aren't.
Yeah, so I think if it's a familial thing, you're in a bit of trouble.
Yeah.
If it's pregnancy, you know it's self-limiting. So you're not really going to treat it. You can take biotin or your pregnancy vitamins, so you can do that. Minoxidil is one that you can take. It's a solution that you put on the scalp. Just be careful because you can order this online. And if you're pregnant or breastfeeding, you shouldn't be using it. It can cause scalp irritation, and it can also cause abnormal hair growth. So if you don't wash your face, you might look like a grizzly bear. You might get hair on your forehead or your cheeks.
Yes, yeah.
So wash your face after. Then there are other drugs like spironolactone, finasteride, estrogen, steroid injections. You can get light or laser therapy. You can get microneedling or protein-rich plasma injections, and hair transplants or implants. They usually use the hair at the back of your head, so it's not so visible.
Yeah.
But it's also not necessarily permanent.
There's so many myths about hair. I was just thinking when you saw the thing about when I saw the thing about hair loss in women, I was just thinking about when I was our whole family when we were kids. When we had washed our hair, my father would take a tot of brandy,
Yes.
and he'd put it on our head, and then he'd massage it into our hair,
Oh.
because he said it'll do two things. Now this is the cuck we were told as children. Okay? Two things. He said you won't catch a cold, and also it will prevent hair loss.
Amazing.
So
You probably had a tot for you and a tot for him.
exactly,
and a tot
een vir
you
jou,
and a
een
tot
vir my, een vir jou. Yeah.
Oh,
But there are myths around hair loss, aren't there?
There's a common one that they say when you shave your head, then the hair grows back twice as thick. I know that's the myth. Or when you wear hats or wigs, you'll lose your hair. That's also a myth.
Okay.
Or if you brush your hair 100 times a day, it looks healthy, or you'll probably lose more hair then.
Yeah.
Other things is intellectual women lose their hair more. Then I should be bald. Or if you stand on your head, that's another one. If you stand on your head, you improve the blood flow, and then your hair will grow better. I don't think that's going to work.
I don't think that's going to work either.
So get to the root of the problem. That's a clever one. No.
That was quite clever. Yeah, that was quite clever.
Yeah.
Yeah.
And then you should
get to the root of the problem, and then just highlight everything that's wrong.
Everything.
Dr. Vicky, thank you very much for joining us
Pleasure,
again.
Jeremy.
And thank you for being with us as well. We'll look at more medical matters next week, Wednesday, right here on Mansfield Today. Until then, thank you for watching, and goodbye.